This is Virginia White, and the continuation of my musculoskeletal exam. I just had to stop it for the YouTube purposes, so I can continue on this section of the video. So we were working on the hip for the last video. Again, I'm going to have you lay down. We're just going to do some specialty tests for the hip. So this test is called the Thomas test. So for this one, I will have him bend his knee up. I'm just going to push his knee toward his spine, looking for any pain there. Any pain?
No.
And with this knee, same thing, looking for pain.
No.
The next one is the Faber test, where I will have him put his heel on the opposite quadricep, so just bend your knee. And I'm going to push his knee down. Any pain there?
No.
We're going to do the opposite. So heel to quadricep, checking for pain. No pain. Sit up for me. So at this point we would move on to the knee. So we can have the patient stand so that we can look for symmetry. So you can stand up. Looking for symmetry while he's standing, making sure there's no redness, swelling, and they appear to be symmetrical. You can sit down. So we would do some range of motion exercises at this point. You can actually go ahead and lay back for a moment. We're going to have him bend his knee up and then straighten back down. You can go straight and up, straight, back down. We can also do some abduction and adduction exercises where I can bend his knee this way, that way, perfect. Same with this one, in, out, perfect. And of course palpating the knee. No pain there?
No. No.
So then we would move on to some specialty tests for the knee. So the first one we would do is the Lotman's test, looking for any injuries in the knee. So I'm going to have him bend his knee here. And I'm just going to kind of pull on each side of the knee here, and he's going to tell me if he's having any pain.
No. 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 No.
The next test would be the drawer test. I'm going to have him bend his knee up. So typically we would be sitting on a exam table, and I would be able to sit on the patient's foot. So for the purposes of this, I'm not going to actually sit on his foot, but that's typically what we would do. And then we would have the patient, I would pull outwards here, and try to have the patient tell me if they have any pain doing that. I'm just going to pull out. Any pain there?
No.
No pain there.
No.
One more time on this one. You can put that one down.
No. No.
Perfect. So for the next test, I'm going to do just some more abduction, adduction exercises. So I'll have him bend his knee here. I'm going to hold down here. I'm just going to try to abduct and adduct his knee, and he's going to tell me if he's having any pain without him doing it. Any pain?
No.
Pain?
No.
These are just the valgus and vargus stress tests. Pain?
No.
No pain?
No.
For the last test is the McMurray's test. I'm going to have him bend his knee here. And I'm going to internally and externally rotate. Perfect. And then the same on this side. Thank you. Again, trying to look for any pain there on that knee. At this point we move on to the ankle. First inspecting for any abnormalities, looking for symmetry. And then having him do some range of motion exercises. So I'm going to have him point his toes up towards the ceiling and down at the ground. And then we're going to go away from his body and in towards his body. And then I'm just going to palpate the ankle here. No pain there.
No.
I don't palpate any swelling. And then we will move on to the foot. Again, once inspecting the foot, looking for redness, looking for symmetry of the feet. So for the foot, for range of motion exercises, we can try to have him rotate his foot in so he could see the bottom of his foot, and then he can try to. You can sit up. Sorry. I mean, I just get your feet back for me. Just put your feet down. I'm trying to see your feet.
Oh.
Just put your feet down.
I'm
So
sorry.
turn his feet in so he could try to see the bottom of his feet, and then try to put them out so he could see the bottom of his feet on the outside, just looking for movement of his feet. And then once again palpating the foot. And then we will move on to the toes. Initially inspecting, looking for symmetry of the toes, any abnormalities in the skin, looking for symmetry, and they look fine. So I'll have him just kind of flex up his toes and then curl up his toes, and then if we can, fan out his toes, and then just bring them back in. Thank you. And then palpate each joint. And no pain there, no swelling noted. That concludes my musculoskeletal exam. Thank you.